Good. So last week we managed to look at a number of viruses that cause disease of medical importance. Uh, the most clear one we talked about was hepatitis B, A, B, C, D, E, but we said majorly under the hepatnaviridae, the most prominent virus that cause hepatitis disease of the liver is hepatitis B. Others we also did mention. Then under orthomyxoviridae, we talked about syncytial viral disease, syncytial viral disease that infect mostly the children under fives. And we realized that most of the children normally get infected by this kind of viral disease. So today we will continue to look at more diseases, and we want to look at this what we call herpes simplex virus type 1. This normally causes disease what we call herpes labiasis, uh, fever blisters or cold sores, especially on the labias. It also causes keratitis. It is more of after these lesions have dried up, we have what we call scaling, and more so it affects the dead skin of the body. It can also cause encephalitis, inflammation of the brain after it has this virus has traveled through the nervous system up to the brain. It can cause brain inflammation, that is encephalitis. This normally virus is what you call icosahedral shaped, and it's a double-stranded DNA virus. I mean, the genome has double strand, and this is how the shape of how herpes simplex structure looks like. Yeah, it is a icosahedral or cuboid or cubic. Those capsomeres are simply the subunits that makes up the capsid, as I did say, is a DNA, and it has an envelope. This herpes simplex type 1, they are normally transmitted through saliva or direct contact with the virus from the vesicle. And once transmission is done, the pathogenetical presentation is where we have the initial vesicular lesions occurs in the mouth or on the face. That's where it begins with this herpes simplex type 1. And then once the mouth or the face is infected, the virus can then travel up to the axon and becomes dormant or latent in the sensory ganglia, what we call trigeminal region, where it is embedded or integrated inside the cell. It can stay there for a long time without the patient showing signs of sickness, but after some time, it can disengage from the cells and cause what we call recurrence in the skin, where the sensory nerves are induced or triggered. By so doing, they release these viruses, and we start experiencing some of the signs like fever, sunlight effect, stress, and all that. So these are some of the things that trigger for the release of that virus that is more dormant. It can spread in patients who are what we call depressed with cell-mediated immunity. So people have immunocompromised system that easily affected by this virus. When you want to do laboratory check to confirm, you can do what we call cell culture because virus only grows in cells. Once you grow them in the cells, you can check what you call cytopathic effect. You can also do what we call a serology and check the antibody levels, or you can also use PCR to detect the DNA levels in the spinal fluid, because you remember we said it can affect even the brain. So once somebody has this disease, some of the recommended treatment is this antiretroviral drug like acyclovir. Acyclovir is a broad-based antiretroviral drug used commonly, especially when somebody is suspected to be having encephalitis and the disease is disseminating or spreading all through the body. Um, this acyclovir has no eidetic on the latent state of the virus. It cannot penetrate the cell to go and kill the virus. If that drug does so, it will also kill the host cells and therefore affecting the immune system. This herpes simplex type 1, we can prevent what using what we call avoiding the specific inciting agents such as intense sunlight, because that's where it can induce the infection. And also, when you take this acyclovir also reduce the recurrences, so it's advisable. But currently, there is no vaccine available for herpes simplex type 1.